Good morning, hi, it's Julien Barker from Chiropractic. I'm here with Barry. Barry's just telling me he's got a bit of lower backache that hasn't kind of resolved from a week ago, and he's been slipping and sliding around in the snow and the mud and the ice and all that. So we're going to run through that. So good. Knees down, climb up and get yourself ready, chap. Good. Okay. So Barry is usually a right PD. You can see it from here. So yeah, that's nice and clear. Makes things easier. And a nice new pair of trainers.
Oh, Christmas present, mate.
Oh, there you go. Good. So we'll go, it's kind of just on the cusp of that. We'll go 0.2, 0.25 on the right one. Call it 0.2. Yeah. And we're starting with a very clear right medial tibia, and the first part of that is an ankle adjustment on the talus, and then straight through the knee joint there. And that's better, but not all the way there. So let's come up, check pelvis. Don't think that's really doing it. Shoving the backside coming up, and I'm aiming for the sacrotuberous ligament, which is super important. Yeah, and there we go. So right PI ilium. So there's 3 points of adjustment on this one. The first one is on the spine of the ischium, so the little bit that sticks out on the pelvis, then onto that sacrotuberous ligament, and then into the iliac fossa. So aiming basically straight for the sciatic nerve. So yeah, very much looks like 3 shots in the butt. Kind of is.
Yeah.
Yeah, as I was taught, the pelvis is the keystone. So you've got to get the keystone right, otherwise it's going to be hard to get the rest of it right. Good, and that's actually leveled him up nicely. Good. Squeeze your knees together and let go. Good, so have your right hand up behind your back and swap your hands around. Both hands up behind your back together, and both back down by side L5 left. Take your right hand up by your face. Big deep breath in and out. And we'll have the left hand up as well. And both back down by side. Okay. So turn your head to the right. Lift the right shoulder off the couch and back down. Shrug both shoulders up towards your ears and back down. So very good example of what's called telegraphing ears. I can see on the T6 test is slightly on the 4, it's really obvious, and then nothing on the 1. So just so take your head back into the centre. So I'll just run. So nice and level there. Turn your head to the right. Go slightly short right, slightly long left. Lift the right shoulder off the couch and back down. Then it really pulls. Shrug both shoulders up to your ears and back down. And that one goes. So head back into the centre. So let's go with the T4 on the left side and then recheck it. That's the one. So 3 layers down, that is thoracic longissimus, the other end of that is there. It's exactly where you were telling me you were feeling it, and that's the one, isn't it? So, just run that again. So turn your head to the right. Lift the right shoulder off the couch and back down. And we can see how that clears beautifully. Yay, good. Squeeze the right elbow flat against your side and let go. Squeeze the left one in and let go. Good. Shrug your shoulders up and roll them back. There's a little bit of something going on with the left shoulder. And there we go. Head back into the centre. T1 rib on the left side. So we'll come down to setting 2 for that. Find that rib junction. Just straight south. Just lift up your head and back down. Tuck your chin down to your chest. Back to centre. C1 right lateral. So other end of the L5 is a cervical 1. Setting 1. Tucked up behind the ear. I have a real habit from doing it from the top of the table. Okay, so just double check that one. So tuck your chin down to your chest, back to the centre. Good. Push face down into the couch and let go. Good. Stretch your right hand towards your right knee and let go. Left hand to left knee and let go. There's a left QL. You are right-handed, aren't you, as I remember?
No, I'm left-handed.
Oh, you're a lefty, there you go, but like me, so. Living in a right-handed world.
Indeed.
Okay, so I think we've got some stuff going on with the shoulders. The first thing I want to check is that T4 tends to come with the pelvis going either internally or externally rotated. So if we just challenge that joint there, you can see we're definitely getting the change, and then we can pressure test to confirm. So that's the corrective line. That one, he clearly doesn't like that in the slightest. Okay, so effectively this is on the PSIS. I'm trying to get as lateral as possible. Good. Okay. Oh, can you feel how your legs have gone all light after that one? Yeah, me too. Good. Okay, so there's got to be some more shoulder stuff going on here. So let's put the palm of your right hand up onto the back of your neck. Lift that elbow up off the couch and back down. Yeah, that is that takes us back to that T3/4 for set. So on the right, push the right elbow down into the couch and let go. And arm back down by sides. Let's try that on the other side. So palm of left hand on back of neck. Lift that elbow up off the couch and back down. Push the elbow down into the couch and let go. Okay, arm back down by side. Left one seems okay. So the T3/4 for set on the right. Do set in 2. And because I've already done a T4 adjustment, I'll go straight for the second part.
I can feel that there.
Yeah, right there. Thank you. Yeah. Well, that is definitely where it's all happening, isn't it? Yeah. Okay, let's just retest it to be sure. So palm of right hand on back of neck. Lift that right elbow up off the couch and back down, which instantly goes further. There we go. And that is good. Arm back down by side. Good. We'll just check some lumbar pelvic muscles and then I think we're there. So push both knees down into the couch and let go. That's good. Push both legs outwards and let go. And push inwards. Let go. Solid. He's pulling a little bit on that piriformis on that right side. Push inwards and let go. Okay. So, PSIS Cross, count down 2, come back across until you find the very sensitive attachment of the piriformis muscle. And just track that line down into the belly of the muscle there, slightly above where I was earlier on. There's the attachment into the hip. Good. So in terms of what's going on, you've got the L5, you've got the PI ilium, there's a slight internal rotation, and then the piriformis. All of that is definitely going to feel sensitive around here. And I'll say what was actually driving it was what was going on up here, and the pressure that the work you do puts on your shoulders. So, fantastic. There we go. I shall see you next time.
Okay, brilliant.